In terms of stuff that can be supplied by the federal government, there doesn't seem to be any rhyme or reason as to which states are getting what and how much from the federal government. Some states are reporting that they're getting stuff that they didn't ask for. Other states are reporting they're getting almost nothing that they asked for. At the moment, New York and the 49 other states in the country and even individual hospitals are all competing against each other and competing against the federal against the federal government on the open market to try to get needed equipment. And even when the military has tried to help, the administration has just absolutely fumbled it. The Pentagon telling reporters now that although they offered more than 2 weeks ago to make 2,000 ventilators from military supplies available for U.S. civilian use, the Trump administration, FEMA and HHS never bothered to tell them where to send any of those ventilators. So the Pentagon is just sitting on those thousands of unused ventilators that they would like to make available to civilian hospitals, but they don't have anywhere to send them. Trump administration hasn't gotten it together to give them any addresses or tell them where the stuff maybe should go. Similarly, the Pentagon made a public announcement more than 2 weeks ago that more than a dozen U.S. military were certified and ready to process coronavirus tests. And the military said it would be happy to make those dozen-plus labs available for that work for the civilian population. But the Trump administration never bothered to respond or accede to that request from the military, and so those military labs have been sitting idle, not doing any coronavirus testing, while all over the country, states large and small are struggling to get their tests processed. I know it feels so late in the game for the national response to still be this screwed up, with way more people dead already than died on 9/11. With the White House saying today that their goal is to keep the death toll to 100,000 to 240,000. I know it feels late for it to be this screwed up, but there's still so much more to be done. Can the medical equipment supply chain be made to function? What needs to be done to make that happen? We should ask the experts on these things. Joining us now is Nick Wallace. He's executive director and co-founder of the USC's Marshall Center for Global Supply Chain Management. Dr. Wallace, thank you very much for joining us. I appreciate you being here.
Thanks for having me, Rachel.
Global supply chain management is an art form, an academic discipline, and an important part of military and business logistics and nonprofit disaster response logistics all over the world. There's people who, like yourself, spend their career studying these things and developing best practices. What's your top-line assessment of how the U.S. is doing on global supply chain management for the types of medical equipment that we need to keep our pandemic response on its feet?
So I think, in my view, we have the public health crisis underpinned by lack of supply chain infrastructure. So let me qualify what I mean by that. I think we just saw various models that's predicting the need for the bed space, need for the patients in ICU. If you back that up just a little bit from a supply chain perspective, we can estimate the PPE equipments, the gloves and the gowns and the masks. And I can actually go down to every SKU, every items, and ventilators in each of this hospital, each of the region, and by what time we have to have those in place. So we do this very well in a commercial space. If we just deploy the similar intelligence in our current crisis in the public health area, I think we could be much better prepared to address this issue.